My next guest was a member of the Biden-Harris Transition COVID-19 Advisory Board. How is the president led on this issue, and what more needs to be done? Joining me now is Dr. Céline Gounder, infectious disease specialist and epidemiologist at NYU and Bellevue Hospital. Dr. Gounder, great to see you. Look, we're trying to take stock of everything. We're doing snapshots. You know, what's the temperature of America's health today?
I think we are approaching the end of this Omicron surge. In some parts of the country, like New York City, for example, where I am, we are back to where we were prior to the Omicron surge, where we were back in September, October. There's still a little ways to go to get back down to the low of June of last summer, but we are making progress in that respect. There is this new subvariant BA.2, which is also a form of Omicron that has been spreading really around the world, not just in the US, that is overtaking the original Omicron. And it doesn't really seem to be causing a new surge. It seems to simply be prolonging this tail of the Omicron surge. I think, unfortunately, where are we headed now? I think a lot of Americans, and I understand this as somebody who has been in the front lines of hospitals, on the front lines of the policy public health response, as well as in the media. You know, I think we're all exhausted. We want to move on. I understand that. The challenge is that we are in danger of repeating the same mistakes that have been made with every epidemic before COVID, which is that we get exhausted, we become short-sighted, we don't build the necessary pandemic preparedness to protect ourselves and insulate and shield ourselves better for next time. And there will be a next time, whether it's another surge driven by a new variant, and there will be more variants, or whether it's another emerging infectious disease. We really do need to do a much better job of preparing for that future. With respect to future variants, some of the modeling done by computational biologists and virologists would indicate that depending on whether you have a game-changing variant or slower mutation, you're looking at probably the emergence of something that is truly game-changing, like Delta or Omicron, whether it's somewhere between every 2 to 10 years. So there's a very wide range there, and it's hard to predict more precisely right now than that. We also anticipate there will be slower mutation of the virus. What will this mean for vaccination needing to revaccinate? That remains unclear. Right now, I think the strategy has shifted a little bit from boosting with updating the vaccines for new variants, and rather developing a what we call pan-sarbecovirus or pan-coronavirus, universal coronavirus vaccine that would protect you not just against all the SARS-CoV-2 variants, but also the original SARS and other coronaviruses. So I think there's going to be a shift in strategy to protect us from the new variants. Vaccine technologies will be a piece of that, but we have much broader preparedness that we need to be putting our funding and our attention into. And I just fear that people are going to commit the same mistakes as before and really just move on without taking those steps to build up our public health systems.
Right. Dr. Gounder, I was very excited to talk to you about this because I wonder, even in the way we frame questions, even today, you know, we're looking at America's report card, but in the segments, I keep trying to raise the international dimension of our performance, our connectivity. You know, I've interviewed people like Dr. Anthony Fauci, Dr. Eric Topol, Dr. Richard Hatchett, you know, who's head of the, I think it's called the Commission for Epidemic Preparedness Innovations. And one of the things that haunts me in this topic is our lack of coverage and seeming concern at some level for where the virus is elsewhere in the world. And that if there are hotspots and if there are variants that are, you know, growing in human beings like us and they can come in, we're somehow talking at this as if we're detached from that. And I just wonder, what is the state of health? What's our report card in making sure that we're not blindly vulnerable to whatever variant it may be stewing up somewhere else? And is that the right way to frame it? Because I just don't hear that discussion as much as I'd like in the United States.
Yeah, I think we tend to be fairly, frankly, provincial in how we think about things here. But if you look at every single variant to date, those have emerged elsewhere around the world where there's been high levels of transmission and low levels of vaccination. And so whether that's was in the UK with the Alpha variant, in Brazil with the Gamma variant, Beta, and Omicron, well, Omicron probably not, but Beta in South Africa. Omicron was detected in South Africa, but probably originated elsewhere. I think we need to be paying attention to what is happening in other places, and that means helping build up surveillance. This is one area South Africa has frankly really excelled and outperformed countries like our own with genomic surveillance. So helping partners, other countries build up that surveillance. And then secondly, making sure that populations are getting vaccinated, not just our own, but also those overseas, because vaccination, while it does not stop all transmission, it does reduce transmission. It reduces viral replication in people who are infected. They don't have the virus replicating for as long. So you do reduce the risk of the emergence of a new variant. And another key piece of this, too, is to really look at immunocompromised populations. We know that chronic infections in immunocompromised people have been the source of variants. And what can we be doing not only to vaccinate them, but to address the underlying immunocompromise? And in many parts of the world, that means making sure people are tested and treated for HIV. And I think that is another piece of this that we have put on the back burner. We know that management of infectious diseases like HIV or TB or malaria have been compromised by the COVID pandemic. And so I think it's really important that we redouble our efforts on that front as well, that we go back to the successes of the PEPFAR programs, which is the President's Emergency Program for AIDS Relief, started under President George W. Bush, which has been very successful, but really making sure we continue to build on those successes to get people who have HIV diagnosed and treated so that we don't have that huge gap, that huge vulnerability in whom you could have new variants emerge as well.
One of the things that has happened recently is the CDC easing masking requirements in a lot of places, in a lot of the country. How do you feel about that?
The CDC is going to be making some announcements later today, providing more guidance on that. The preview I've gotten is that the metrics that will be used will be more logical for where we are in the pandemic today. Certain metrics like test positivity don't make a lot of sense today. A lot of people are using home rapid tests, so those numbers don't figure into the official testing numbers. So it's really hard to interpret those test positivity numbers. So the focus moving forward will really be on cases, number of cases, how quickly they may be increasing in an area, hospitalizations, but also importantly, hospital capacity, because a big surge in a place like Boston or New York City or San Francisco, which has lots of hospital beds, is very different from a big surge in a rural part of the country where you may have one hospital serving hundreds of square miles, and it might be a couple hours away to your nearest hospital. So there does need to be some tailoring by where you are in the country and whether they can handle a surge. So I do think you're going to see those guidelines announced later today. And I do think those are grounded in metrics that are appropriate for where we are today.
I've got the House Majority Whip, Jim Clyburn, waiting, so I'm not going to keep him waiting long. He's a great guy, and I just do not want him to run away. But I just want to ask you, briefly, as a member of the Biden transition team, perhaps this is an unfair question. As you look at the Biden team and as you look at things, whether it's masks and test kits that have gone out, but also what you said at the beginning, which I was very sensitive to, that we're continuing, I think you said this, not making the kinds of public health infrastructure investments we have to make, not using this crisis to prepare for the next. How would you grade the team that you've been giving advice to?
I think they have been, up until really the Omicron surge, they were really focused on vaccination. And I think vaccinations are very important. But when you have a third of the population that remains unvaccinated, that a significant proportion of whom may not get vaccinated, refuse to get vaccinated, you really do have to layer other measures because there will be more, as I said, surges, variants, and we need to protect our hospitals so that the healthcare system continues to function. And we need to continue or do a better job of protecting the most vulnerable who unfortunately have borne the largest brunt of this and will continue to do so.
Well, I want to thank you, Dr. Céline Gounder, an infectious disease specialist and epidemiologist at NYU and Bellevue Hospital, and of course an editor-at-large and senior fellow for Kaiser Health News. I like all, and the Kaiser Family Foundation. I have a soft spot for any editor-at-larges, so really great to see you. Thanks so much for joining us today.
My pleasure.